I've already verified the doctor's orders and my equipment is already in the room, as I've already done a full assessment, ventilator check, and I've already suctioned out the artificial airway. Hi, Mr. Johnson. My name is Brandon. I'm a respiratory care student. I'm here because I need to do a little bit of maintenance with your ET tube today. Can I get you to verify your name and your birth date for me?
Sounds good.
Awesome. Thank you very much. Okay, so we've already got you sectioned out. It does look like we've got a 7.5 ET tube at 24 on the top lip. So I'm going to have to pull that out to about 2 millimeters to 22 so we have a better fit. Before I do that though, I am going to suction out your mouth and your throat just above that cuff so that way none of those secretions gets down into your airway. So this is going to be a little uncomfortable. Good. All right. So you're going to feel a little bit of a release of pressure because I'm going to undo that cuff just a little bit so I can move your tube. I'll get you off of this. All right, you're going to feel a little bit of release of pressure. And I'm going to pull it out just out to 22 at the top of the lip. All right, we're now at 22 on the top of the lip, and Mr. Johnson, I'm just going to move this over to the left side of your mouth, and then I'm going to blow up that cuff again.
I'll be back here in just a little bit to check.
Okay, and just to make sure I've got that cuff fully inflated, I'm going to double check the pressure. But before I do that, I am going to just take a listen to you. Alright, awesome. I do have bilateral breath sounds, so it looks like that tube is still in a good spot. And I'm gonna plug this in. I'm gonna decrease a little bit of the pressure. Alright, we're now at 30 centimeters of water pressure. If I was gonna do a minimal leak test, I would deflate the cuff just slightly to where there's a little bit of a leak and then listen for air movement over the neck. Otherwise, we will be back to check on Mr. Johnson here later today. Is there anything else I can do for you today? All right.